Alrighty, today here we have Mason Charlton, and he is a 21-year-old male who runs track and field at the University of Cincinnati. He has an ACL injury while sprinting, boop, and is able to return to sprinting after performing some rehabilitation on his knee. Before his injury, Mason ran well in the 100 meter, the 200 meter events. He has explosive starts and a high top speed. Ever since his injury, he has completed a physical therapy plan and now is preparing to return to sprint training. And he is still gaining strength and confidence in his knee, and his goals are to restore full sprinting capacity, improving stability and preventing another injury. So we will include progressive training, neuromuscular control, and drills to prepare him for his return to sprinting. So our patient's main 5 goals are improving speed, improving our start and acceleration. They are to increase power output of the legs. They are to build cardiovascular fitness, and they are to strengthen the knee joint to avoid any possible future injuries. All right, so first we will be doing a PAR-Q, and this basically makes sure that there are no cardiovascular, respiratory, or metabolic risks before our exercise. So, Mason, has your doctor ever said that you have a heart condition or high blood pressure?
No.
Okay, please mark that on the paper. Do you feel pain in your chest at rest, during daily activities of living, or during physical activity?
No.
Okay. Has your doctor ever said that you should only do medically supervised physical activity before?
No.
Okay. And our PAR-Q is good. Okay, so now we will do a blood pressure test to make sure that Mason's cardiovascular health is ready for all of his exercise that he's going to be doing. So we place this line on the artery right here, and then we go this, and then we pump this up, and Mason has a blood pressure reading of 118 over 78. All right, so now I will be taking Mason's heart rate, and basically we're doing this just to make sure that his resting heart rate is at a good rate for him to be able to exercise on a regular basis. So, or at the intensities that we are going to be giving him. So I will put this right here. Awesome. And Mason's resting heart rate is at about 68 beats per minute. Alrighty. So right now we will be measuring Mason's BMI. So Mason, what is your height?
6 foot.
And what is your what is your weight?
195 pounds.
Alrighty, so let's go ahead and plug this into the calculator over here. And Mason, your BMI is 26.4. Now the reason we do this is is to compare at the end whether or not Mason has gained muscle mass and lost body fat during his exercises at the end of his treatment. Alrighty, so now we will be doing a health screening questionnaire. So basically, this is just to collect a little bit of information about Mason's ACL tear and just some general information, just to make sure that he doesn't get re-injured during training. So Mason, are you done with that questionnaire, man?
Yes.
Got the signature. All right, so as I'm seeing here, no additional concerns are coming from conducting this questionnaire, and you should be good to go with your exercise. All right, so now we will be doing, for our first exercise assessment, we will be doing our balance error scoring test. So this test allows us to make sure that Mason's balance is fit with his sprinting level. We will have Mason stand on a foam balance pad for 20 seconds with his eyes closed on each foot, so on his dominant and on his non-dominant foot, and count the amount of stumbles that he has while performing the test. This allows us to identify the instability that may linger from his ACL tear. Alrighty, so Mason, I'm gonna have you get up and stand. I'm gonna time this for 20 seconds. Alrighty, so you are all good. And then I'm gonna give you a little bit of a break there. So you did very well on that one. I gave you a score of 2. So if you could do your other foot now. Awesome, and you are all good. And Mason, I'm gonna give you a score of 3 on that one. So obviously, there is no instability lingering from that ACL tear, and we should be good to go. All right, so today we will be doing the 40-yard dash, and this is typically used in football drills to measure acceleration, top speed, and stride mechanics. These details are all incredibly important when it comes to being a sprinter. Improvements within this test will show us whether Mason has improved to where he was before his injury. So, Mason, 3, 2, 1, go! And Mason's 40-yard dash was 4.8 seconds. Alrighty, so now we will be doing a vertical jump test. So this tests low body power, which Mason excels at. So we are able to use this test to measure Mason's power improvements throughout our training. He wants to enhance power improvements in order to enhance his starts off of the block, and this helps us monitor his progress and possibly help him with his acceleration and starts while he is sprinting. So, Mason, if you can go ahead and jump as high as you can. We measured before, so it looks like Mason jumped a total of 10 feet. Alrighty, so now we will be doing a hand grip dynamometer test. So this test gives us a number that we can compare a test to after our exercise program. So this is because grip test is associated with overall strength, and therefore that would give us an idea of how much our patient has progressed strength-wise throughout our treatment. So Mason, what you're gonna go ahead and do here is squeeze this for 3 seconds, as hard as you can, and yeah. 2, 1,
Go.
Okay. And Mason, we got a reading of 130. Alrighty. Alright, so now we will be doing the 1RM back squat. So this is a maximal effort test that allows us to access power development throughout the trunk and the legs. So the maximal back squat allows us to focus on lower body force production with a focus on the glutes and the quadriceps. Both of these muscles are essential for sprinting, so it's important to make sure that they are strong enough and have enough power to maintain these short bursts. So Mason, I'm gonna have you do a squat real quick. So stand in front of the bar and go ahead and put it on your neck. There we are. Now lift the bar, and you could go ahead and perform a squat, a deep squat for me. Alrighty, and that felt maximal effort. Okay, now re-rack it, and that is our 1RM squat test. Alright, so today we will have Mason perform back squats. So we're gonna have him do these twice per week. We will start off with around 70% of his 1RM and have him do 3 sets of 6 to 8 repetitions. So for our example here, we'll just do 1 set, but this type of lift lets us build the lower body by strengthening the glutes, hamstrings, and quadriceps. All of these muscle groups are essential for sprinting and for ACL support. Squatting also makes sure the knee stays stable under a controlled load, which helps aid in joint health in the long run. Including rest, 3 sets of this exercise should take around 15 to 20 minutes. So Mason, do you want to go ahead and do 1 set of this back squat? Alright, so those are our barbell back squats. Okay, so for our deadlift, this lift will be performed at a moderate intensity twice per week, and it will be lifted around 75% of Mason's 1RM in 3 sets of 5 repetitions. So for our example, we'll only do 1 set, but the movement is critical for driving his hips while sprinting and obtaining power during his block start. Including rest, 3 sets of this exercise should take around 15 to 20 minutes. So Mason, whenever you're ready. All right, so now we will be doing Bulgarian split squats. So this lift will be performed twice a week. Mason will perform 3 sets of 6 to 8 reps per leg using a barbell that is about 70% of his predicted 1RM. This exercise helps correct imbalances within the legs and helps Mason improve his sense of balance as well. This is especially important because of his ACL tear. This exercise targets the glutes and the quadriceps while requiring the knee and hip stability, including rest. 3 sets of this exercise should take about 15 to 20 minutes. So Mason, if you could perform 1 set for me. Great job. Alright, so now we will be doing box jumps. So these will be performed twice per week with 3 sets of 5 to 6 repetitions. So these help build Mason's reactive strength. His body should be able to respond well to impulse movements such as jumping up and down from a box. These also train Mason's coordination, allowing him to improve in his sprint starts, and we will start at lower heights such as this one today to make sure his recovering knee isn't overstressed, and then we will work higher from there. So including rest, 3 sets of this exercise should take around 15 to 20 minutes. So Mason, if you could do 5 to 6 repetitions of box jumps for us. All right, and as we can see, Mason's knee is doing great there. So maybe next week we can move up a little bit in height. All right, so now we will be doing sled pushes. So these should only be done once per week, but Mason will perform 5 sprints of 20 to 40 yards with a moderate resistance. So this will allow Mason to accelerate more quickly over time, and this is a great way to build acceleration during an ACL recovery because it actually strengthens the body without causing as much joint strain as sprinting would. These pushes should take about 40 minutes to complete. So Mason, if you could sprint 20 yards with this. Alrighty, 3, 2, 1, go. And there we go. Good job, Mason. Okay, so now we will be doing a lateral band walk. So Mason should perform lateral walks using bands. The bands should have a moderate tension, and he should perform these walks with about 3 times per week for 3 sets of 12 to 15 reps. These band stability drills will reinforce knee stability, addressing any instability that may be left in the ACL. So these drills should take about 15 to 20 minutes to complete, including rest. So I will go ahead and show Mason what this will look like. Let me put this down. So right here, bend down this way, and back and forth just like that. There you are, Mason. Good job. All right, so now we will be doing leg extensions. So these movements are very important when it comes to strengthening the quadriceps, one of the most important muscles when it comes to sprinting. So these should be done twice per week and at a moderate band intensity. So if needed, we can increase the intensity once we are sure that Mason's ACL is okay with the current intensity. We will do 3 sets of 6 to 8 reps to maximize muscle growth within the quadriceps, and this session, including rest, should take about 15 minutes to complete. So Mason, I'm gonna go ahead, so I'm gonna hold the band here for Mason, and what Mason is going to do is extend his knee like so. And if you could do that one more time. And good job, Mason. Okay, so now we're about to do another movement that is equally important as our last movement, except it helps strengthen the hamstrings, another important muscle when it comes to sprinting. So these again should be done twice per week at a moderate intensity, and if needed, we can increase the intensity once we are sure that Mason's ACL is okay with the current intensity. So we will do 3 sets of 6 to 8 reps again to maximize muscle growth in the hamstrings. And this session, including rest, should take about 15 minutes as well to complete. So, Mason, alrighty, if you could flex there we go, flex your knee, there we go. And if you could do it one more time. There you go. And that is our hamstring curls. All right, so now we will be doing something called a backwards walk. So the backwards walk helps Mason maintain a little bit of balance and coordination as a runner. So these types of walks are usually meant for athletes returning from an injury. It helps encourage step control and mobility, which are both important for a runner. These walks should be done twice a week, low to moderate intensity / speed, and 3 sets of about 5-minute walks. These bursts should help encourage overall endurance within our sprinter, and including rests, these walks should take about 30 minutes to complete. So I will go ahead and show Mason first. And that is our backwards walk. Awesome, and good job, Mason. Okay, and now we will be doing quadriceps stretching with band. So 2 recovery and mobility sessions, at least for the quadriceps, should be held per week. These sessions help focus on the quadriceps as they are incredibly important when it comes to sprinting, as said before. These recovery times are important just to help improve circulation, reduce soreness, promote recovery, and it also allows Mason to maintain his flexibility as a runner as well, which is equally as important. So this helps with Mason's ACL recovery as well. So these stretching sessions should take about 15 minutes each. And so Mason, if you could pull, I'm gonna pull the band right behind your leg like this. And if you could grab this band. And so what Mason is doing is stretching his quadriceps by pulling his leg up like this. And if you could let it go. And that is Mason's quadriceps stretch.